Welcome back to RITP podcast. I am your host, Kokeb McDonald. I am a pediatric occupational therapist and the founder of RITP. Today, we are diving into one of the most misunderstood and overlooked areas in child development, which is vision. And specifically, why having 20/20 eyesight doesn't mean your child or client actually has functional vision. We'll talk about what visual skills really are, why therapists, parents, and educators need to know the difference between acuity and perception, and how this impacts a child's ability to learn, play, focus, and thrive. So let's start here. Vision is more than just how clear a child sees on an eye chart. In the therapy world, we break down vision into three big areas: visual acuity, visual efficiency, and visual processing or visual perception. Visual acuity is how clearly the eyes are seeing. This is what the school screening or pediatric screening checklist will look like. Visual efficiency can be how well the eyes work together. This includes skills like tracking, convergence, segment, or eye teaming. And visual processing or perception, this is how the brain interprets what the eyes are seeing. This includes visual memory, discrimination, spatial awareness, figure ground, so on. Okay, so when a parent says, my child passed a vision test, that only tells us one piece of the story or the puzzle. Many children struggle in school, not because they can't see clearly, but because their vision system isn't working efficiently. Imagine trying to read with blurry glasses or a bouncing word. If I make the words bounce on the screen, can you read it efficiently? Or the paper is shaking, or you missing the space, whether or not you can track from the upper right side to the lower left side. Or picture looking at a crowded worksheet and being unable to filter out the background. So there is so much more than just being able to have 20/20 or clear vision. Let's connect the dots. Poor visual efficiency or perception can lead to avoiding near working, like reading, coloring for some kids, depending on the age level, working on puzzles. This actually lingers in adulthood, and later on will have difficulty being able to see things in the crowd, even driving, making it difficult for them able to merge in oncoming traffic. This is something I've heard, even adult clients that I work with, something that they came to a session to work with me, and even other therapists, some of the concerns that they have is being able to drive. So this is something that can be very dangerous for adults, so it can carry on, it lingers. For students, if you're an educator, it can be for a client or your student losing their place when copying from the board, letter reversals, or messy handwriting. It can be poor attention. Yes, attention. We'll talk a session and another podcast about attention and vision, how they relate. But it can be poor attention and fidgeting frequently, getting headaches, or if you see them rubbing their eyes consistently. These are some of the symptoms you might be able to look at, and this might be familiar. So if it sounds familiar, something to look into with the client that you're working with. So what's often happening is that visual system is under some kind of strain. So children may avoid these tasks or act out, not because they are misbehaving or not paying attention to you or just lost interest, but because the visual system is overloaded. So some research, because this is important to know that there's more and more research that is being done, and I found this very alarming, is now research shows that 1 in 4 children has an undiagnosed vision problem that affects learning. That is from 2023 research. From the research here, it says that undiagnosed eye problems can affect children's learning. Vision disorder can lead to problems in child's normal development, school performance, social interaction, engagement in athletics, and self-esteem. Vision disorders that occur in childhood may manifest as problems well into adulthood, affecting an individual's level of education, employment opportunities, and social interaction. So more and more research are being done, and we'll link the article below for you to look into. So 1 in 4 children being undiagnosed with vision problem should give us a pause and as specialist service provider to look into what to do, what we can do, and who we should be consulting and working together to make sure that our clients are not left behind. So now let's take it a little bit deeper. Inside the RITP program, of course, we train our therapists to look for how primitive reflex patterns can block vision development or affect vision development. So in addition to multiple other reasons affecting visual problem, routine reflex patterns can be one of them that you should be assessing and looking into. For example, if a retained ATNR in the body, how the ATNR influences is not just the body also influences visual processing. So this can make it harder for the client to track across a midline. So usually with kids or with adults, even we work on midline crossing. Midline crossing is not just physical, it's also visual. So that's something to look into. If you work on TLR, for instance, this is the tonic labyrinthic reflex. It affects postural, head control, front and back, body alignment, can also influence part of a visual system, which is the peripheral vision. It also affects indirectly because if posture is affected, as the child or the adult is not able to keep the head aligned, it will affect how they align the head through gravity and being able to track. So that is another area that we need to look into. So there is a constant assessment we need to do. And inside RITP, we talk about it too. So we have to look at functional skill. We have to look at developmental milestone. Here, we're going to look at specifically if you're targeting visual skill, you want to also look into visual skill development and milestone. So these are something you're going to connect the developmental progression as well as the reflex integration piece of it. Our STNR helps us with a part of our visual tracking. So when a child is on all fours, that's when the child is aligned their head and be able to lift the head against the gravity, lift the head up while aligning front and back and tracking near and far. So that is part of the developmental progression. So that's something we need to work into. Other reflex patterns that can be involved can be the Palmar graphs, even the Babkin reflex with the eye-hand coordination piece, because it's eye-hand coordination, being able to look at something and then being triggered, which is involved with the TNR, because the child will look at a visual input, a toy, they might look at it and they want to grab it. With that connection, you can see how visual skill is connected in those developmental progressions. So all of these brain-body connection, all of these reflex pattern kind of come together to help us have a voluntary movement pattern later on. So it's important not to only just look at the muscle that we're going to work on, because there's about 6 muscles that influences the eye movement, which we talk about inside our visual skills and primitive reflex developmental core. So if you are interested, come join us in RITP. We will be discussing that. And there's one course actually coming up really soon, next month online. If you are able to join, make sure to join up and we'll have the link below. Inside there, we will talk about the anatomy of the eye. There are 6 muscles that influences the eye, but it's not just the muscle that we want to work onto, but we also want to work onto the perception aspect of it. And then there's a lot of other areas that we need to consider. So I can't go in detail of everything that we need to look into when you're screening. Of course, if you're a specialist, please go to places that you can get in-depth training. You can definitely come to us. Don't try to do this DIY looking into, online and figuring out yourself. Please get a full training and understanding. This takes skill to screen really well. So sometimes I feel a little bit hesitant to give advice because I found that some people might take it like, okay, that's the one answer and it has to be that way. And it's really case by case, and you have to have a holistic approach of assessment. For the sake of this podcast, what I wanted to share is to know that vision is one area that is missed a lot. And even in my earlier therapist career as an occupational therapist, that I failed to screen myself. And I focus more on gross motor, fine motor, and other areas. For whatever reason, for the longest time, I failed to screen for visual skills. But now looking back, that's something that, I have failed and even on my own experience. And I realized that the more I'm teaching and working with other therapists, that's the area that they fail to test too. So it's important for me to come here and share with you that to remember while you're working on whether it's handwriting. I know a lot of OTs get asked to work on handwriting, whether it's handwriting or even attention. I wanted to make sure that as an occupational therapist that we do not fail to screen for vision, and it's really, really important. And you screen for reflexes, definitely screen for motor skill, fine motor skills, but also screen for eye teaming. And we'll talk about it more when you come into the course, and we'll train you if you're interested. For the sake of this podcast, though, I don't want to go like too deep in this and lose my focus on what I'm trying to tell you for this week. There are a few areas that what therapists, parents, and educators can do. Okay, so what can you do right now? And I want you to be able to at least go and check it out with the clients that you're working with. Go and screen for some. When I say screen, it's just observe. So a screen for visual efficiency. Don't rely on just visual screening alone, meaning just the child can see 20/20, or even when you're working with any client, don't assume that because they're not wearing glasses or they got tested and they're fine. Look for signs when they are working with you. As you're working with the clients and you're observing their movement, their fine motor, gross motor, other areas. Also look at their visual. If they're squinting, they're covering one of their eyes, they're tilting their head to look, avoiding near work, or if they're complaining of fatigue, the minute you're giving them something to read, they're saying they're tired. They're showing you physically they're tired, but probably what they're not telling you or they don't have the words to explain to you is like their vision is tired, they're fatiguing. And then if they have a hard time tracking, when you're working on catching a ball, for instance, if you're a PT and you're working on catching a ball, if you're an OT screening for catching and throwing a ball, if they're missing a lot, if they can't track the ball or a balloon you're playing with, it's not just a motor skill, but it's also sometimes can be a vision skill. So make sure that you look for visual tracking, track for visions near, far. You can do saccade tracking and also fixation. So those are some of the areas you can look into and then screening for that. Definitely observe for reflex pattern. See if their body still retained some reflex pattern in their body. Learn to recognize how retained reflexes are present in the classroom, what it looks like when they're actually doing functional activities, when they're copying from the board, when they are in the playground, when they're playing, when they're writing. Screen them for reflex pattern. Definitely partner with a developmental optometrist, a vision therapist. They specialize in working on vision, and it's important to work with a specialist when it's necessary and not assume that we can DIY our own treatment. Most therapists are skilled in some areas, and it's important when the time comes to refer out. So you can screen in your session, you can observe so that you can be able to refer out. As therapists, of course, you can work on retained reflexes, you can work on accommodation, and you can work on brain-body connection, activities like that. But then there are other specific areas that vision therapists are trained to screen. So I recommend that you connect with them and see if you miss something, and then making sure that the client gets the best services. And then when it comes to activities, but in RITP, of course, we do play-based activity, purposeful activity, and functional-based activity. So implement movement-based activities that also targets visual skills that can support you. So if you're in the community, most of them have the RITP app. So inside the RITP app, make sure to look for the starter visual skill exercises. And they're designed to be easy to use, play-based and therapy-based and movement-based kickstart visual activities that you can use right away and also have a multiple purpose for it. Of course, we're targeting multiple things with our activities that we use in RITP. Reflex integration, we want to target functional skills and developmental milestones. So as you are incorporating these movement patterns, try to target the ones that can clearly focus on visual skills for you. Also, as a therapist, if you're an OT listening to this or you're supporting educators, teachers actually can integrate a lot of simple movement and movement breaks while they're seated or just before they start handwriting activities that they can implement in the classroom. So activities that they can do just before, even like a movement break that they can do to get the eyes ready. You can do activities as simple as, I'm not saying this is going to fix everything, but this is just to get the child's eye moving and then making sure that even the educator can actually start tracking and seeing whether or not the client that they're working with have a good eye teaming to help them learn. Because we use 100% of the time with the teachers, unless you're visually impaired schools, most kids, they rely with vision. Vision is what they rely on to learn. And the classroom is copying, it's reading, it's find more activity, it's attention and focusing on the teacher and being in a very messy classroom, finding their way around in a very busy playground, finding their way around, playing with kids, all heavily relies on vision. And that's something that we tend to miss to screen. And it's beneficial for other team members to also know how to screen, what to look for. So as a therapist, you can also teach your teachers to scan just as simple as just 6 inches or 7 inches away and have the client or the student be able to track slowly. See if the eyes are able to track. Can they cross the midline? And have them see if they can do like exercise, which is like the eyes jumping from one end to another. It can be like looking at an object, having their thumbs up, and then can they look from right, left, right, left, right, left. Activities like that. See if the eyes are able to do that. You can do it horizontally, vertical, you can do it diagonal. Just few activities to see in a play-based way, whether or not they can do that. Activity helps us with copying. Copying is like you are jumping from the paper and from the board back to the paper. Our eyes need to be able to converge and diverge very quickly, and these muscles need to work really quickly. And most kids actually fatigue, not able to perform because of the eyes, not because of other challenges. And sometimes we miss it because we are not screening, we're not thinking about screening vision. And I want to bring this topic to our community here and definitely want to hear from you as you go back and check these vision skills with your client and your students and let us know if you picked up on something. And it's very important for you to even create a treatment plan that is effective, because if we don't really go to the root cause, it will be treating other things. And then we will have a treatment plan really is not even help the core challenge. Instead, unfortunately, actually, if we have a wrong treatment plan, sometimes we might actually end up creating different issues. Now you are frustrating the child. We're not really helping them. We're extricating them. And then they're going to respond and we're going to think it's a behavior issue. And we deal with the behavior and we're treating the behavior now. And then we never got to the foundation. So I really encourage you to go back and check with, if you have a full case, I guarantee you out of your full case, you'll find at least certain percentage of your clients have some kind of visual tracking challenge. And I want to hear back from you. And one of the next episode, we will be talking about how vision and attention can correlate and then what the data is showing us. In the meantime, if you are a service provider or a parent, even an educator, who, as long as you're working with clients, I encourage you to explore the RITP Visual Skills and Primitive Reflex Development course. I will be going live inside the course in our community. Those who have access to the program do a live training and also a little bit of a Q&A with that community on August 22nd. But if you missed that, that's totally fine. We'll have the recording there for you. But in the meantime, check out that course because I do go a little bit in depth about what visual skills are. Reflexes, you can look at screen and activities that you can implement that are play-based for teachers and therapists to implement in the clinic. So I encourage you to do that. Check it out if you're interested. Make sure you go to the show note and find everything that you're looking for. In the meantime, if you are interested to learn more and to be part of this community and make sure that you get a podcast notification, make sure to subscribe. Thank you so much for being here, and I appreciate you for listening, and share this podcast with other educators. And in the next episode, we'll go a little bit in depth on vision, and I'll see you there. Until next time, keep playing with purpose and integrating through movement. Talk to you soon. Bye.